So today's topic is organic mental disorders. So when you come to the psychiatric disorders, there are three categories of disorders which we have. One is we know the known cause and the that is called as the organic disorder. The second one is there is a causation factor but we are not know exactly what it is. It's not been proved. And the last one is psychosocial factors. So the first category, which is because of an organic reason, these are called as organic disorders. So what are these organic disorder? It is because of some abnormalities of the brain function. Because of this, the person comes with a behavioral symptom. Okay. So coming to the definition of organic mental disorder. So organic mental disorder are behavioral or psychological disorders associated with transient or permanent brain dysfunction and include only those mental and behavior disorders that are due to demonstrable cerebral disease or disorder, either primary, that is primary brain pathology, or secondary, that is brain dysfunction due to systemic disease. Okay, very lengthy definition. So but what does this definition basically mean? So it basically says that organic mental disorders are those mental disorders where you can demonstrate that there is a problem in the brain function. Okay, so one can be it can be transient, means which just comes and goes, or permanent, like a head injury or a stroke, CVA or something like that, which can be either primary brain disorder, that is like it could be a brain tumor or head injury, or it could be secondary, like your hepatic encephalopathy, renal encephalopathy, because of the chemicals which increases in the blood, it affects the brain and the person can have organic mental disorders. So what are these basic organic mental disorders? We have delirium and dementia. These are the main two conditions which you have to know. Of course, there are other organic like amnesia is there, organic amnesia. The other one is organic mental disorders are there, like you can have personality disorder and all that, because of organic onset. Okay, so coming to this various organic mental disorders. So first we have the organic mental disorder, which is delirium. Delirium is an acute organic mental disorder which is characterized by clouding of consciousness and disorientation. Okay, so clouding of consciousness and disorientation is the main symptom which you have for delirium. So it is an acute organic mental disorder. So what this is like, it is seen under 5 to 15% of patients who come to to medical and surgical wards can develop organic, that is delirium. More so with post-operative patients, CCU, the chances are much higher that they will develop this particular condition. Okay, so what are the clinical features? The first clinical feature is it is acute onset. Okay, so 1 or 2 weeks it takes for the onset of this condition. The second one is clouding of consciousness. Clouding of consciousness is they're not aware of the surrounding, they don't respond properly to the stimuli. That is called as clouding of consciousness. The third one is disorientation, mainly to time and place. They don't know where they are, what part of the day is. These are the three main features. Apart from this, they'll have illusions and hallucination, mainly which are visual. Okay, the next one is the patient will have insomnia in the night and they'll be very drowsy during daytime, and there will be a reversal, okay, of this symptom and worsening of the symptoms in the night. So this is called as diurnal variation, and this worsening of symptoms in the night is called as sundowning syndrome, SUNDOWINING. So sundowning syndrome is the worsening of these symptoms in the night. And also they have registration, immediate memory is affected, and psychomotor agitation can be seen. Retardation is rare. There will be autonomic disturbance, all the vital signs will be affected, and the person can have slurring of the speech, delusions can be there, motor disturbance can be there. These are all the symptoms of delirium. So, how do you come across these patients? Usually, you come across patients with delirium in general and surgical wards. So, who are these patients? Okay, what is the etiology? What is the causative factor? So, in a textbook, it gives that A, B, C, A to G. A is metabolic causes. So, metabolic causes like hypoxia, carbon monoxide poisoning, hypoglycemia, hyperthermia. Then you have hepatic encephalopathy, uremic encephalopathy, cardiac failure, cardiac arrhythmias, cardiac arrest. Okay, then you have water and electrolyte imbalance, especially sodium, potassium, calcium imbalance. Then you have metabolic acidosis and metabolic alkalosis. Then anemia, fever, hypovolemic shock, and these are the main causes of the metabolic causes. So it can be because of hypoxia, hypoglycemia, hyperthermia, fluid and electrolyte imbalance. Okay, these are the metabolic causes. Endocrine causes are hypo and hyperthyroidism, hyper and hypoparathyroidism, hypo or hyperadrenalism, hyper or hyper pituitarism. Any of these endocrine glands, hyper or hyperfunction, can lead to delirium. The third is drugs, either consuming a particular drug, or it could be withdrawal symptom, can lead to delirium, and also poisoning can cause. So example is digitalis, quinidine, hypertensives, alcohol, sedatives, hypnotics, okay, TCS, tricyclic antidepressants, antipsychotics, anticholinergics, disulfiram can cause. Then anticonvulsants, opioids, salicylates, steroids, penicillin, insulin, and the last is methyl alcohol and heavy metals. So all these can cause delirium. The next cause is nutritional deficiency, mainly thiamine deficiency, niacin deficiency, pyridoxine deficiency, folic acid deficiency, B12 deficiency. These are all the vitamin B deficiency, and it can also be because of protein deficiencies. Now the next is the symptomatic systematic infections like your septicemia and endocarditis. All this, so acute and chronic infections can also systemic infections can cause delirium. The next one is increased intracranial causes like epilepsy, head injury. We can have intracranial infections like meningitis, encephalitis, migraine, stroke, lesions like abscess or cancer. Okay, so these are all the intracranial causes for delirium. Now coming to the miscellaneous cause can be the post-operative states like putting the patient when the patient is ICU, sleep deprivation, heat, electricity, radiation. Okay, all this can also cause the person to develop delirium. Okay, so this is the etiology of delirium. So again, usually it is seen with extremes of age. Very young people or very old people can develop delirium, and when there's a previous history of delirium, there is another predisposing factor, and when there's focal or generalized lesions in the brain, then they can have this seizures is another reason. Post-operative stage after a major surgery, okay, when the patient is on antipsychotics, these are the people who can develop delirium. Now coming to the management. So management, when a person comes with delirium, first we have to see what is the actual cause, okay, what is the contributing factor. Okay, so it will include a complete blood test, urine analysis, blood sugar, urea, creatinine, okay, and liver function test, renal function test, partial pressures of oxygen. So PCO2 is checked, X-ray, ECG, EEG, VDRL, HIV, EEG, CT scan, MRI scan. All this has to be done to rule out what is the actual cause. Okay, and then there will be, you identify the cause, and the management is based on the cause. For example, if it is hypoglycemia, 50 mg of 5% dextrose is given. Okay, so usually in casualty you must have seen for hypoglycemia. If it is hypoxia, oxygen administration. Fever, antibiotics are given. Okay, so the fluid electrolyte imbalance, this have to be replacement of the electrolyte has to be done. So it's basically symptomatic management. If the patient is agitated, then emergency whatever psychiatric treatment has to be done. If is agitated, violent and all that, then we have to give the patient diazepam or haloperidol is basically given to the patient. Okay, so this is basically done. And supportive medicine and nursing care is basically the mode of treatment for a patient with delirium. Okay, so delirium is a acute brain disorder, and it is characterized by clouding of consciousness and disorientation. And then we basic, so it can also be illusion, hallucinations, delusions also can be present in these patient. And we saw the etiology and the management of a patient with delirium. Okay, so with this we come to the conclusion of this particular topic. Now, as a nursing management, you have to basically see when the patient, you have to have your emergency medicine ready for this patient. And also the patient can be violent, so the management of a violent patient, which we have discussed before, how to handle a violent patient, you have to be prepared to handle a agitated or a violent patient. And the facility should be there in the ward where there's very clearly what is a ward, which ward is it, what is the time, the date should be marked in the calendar, so the patient gets oriented. Repeatedly you have to tell the patient where the patient is. You know, you're in this particular ward, you're in this hospital, I'm the nurse, you're in this ward. You have to keep it repeatedly telling this person where they are, so they do not get disoriented and then they get agitated and confused. And any of the cellular electrolyte imbalance, everything has to be managed immediately. Okay, that's a brief of the nursing management of a patient with delirium.